Good day to everyone who will be watching this video. I'm Abba Bishop Marvelous, a 200 level student of Human Anatomy from Prince Abubakar Aldo University. In this anatomical exhibition video, I'm going to be talking on the cubital and popliteal fossa, their relationship, their borders, content, and clinical correlates. To start with, what's the cubital and popliteal fossa? The cubital fossa is a triangular depression in the upper limb, specifically located anteriorly or in the anterior aspect of the elbow joint. It contains several neurovascular structures and serves as a transitional area between the arm and the forearm. Secondly, what's the popliteal fossa? The popliteal fossa is also a depression, but it's a diamond or rhomboid-shaped depression located in the lower limb, specifically or precisely posteriorly to the knee joint. It also contains several structures, and it is a transitional area between the thigh and the leg where blood vessels and nerves pass through. Now, the relationship between the cubital fossa and the popliteal fossa is a homologous relationship. Otherwise, you could say the cubital fossa is homologous to the popliteal fossa. When standing anatomically or in anatomical position, the cubital fossa faces anteriorly while the popliteal fossa faces posteriorly. The cubital fossa will be more prominent when the forearm is flexed, while the popliteal fossa will be more prominent when the knee is flexed. Now, what are the borders of the cubital fossa? Note that the two sides of the cubital triangle, which mainly forms the cubital fossa, is comprised of the two forearm muscles, which are the brachioradialis and the pronator teres. The cubital fossa has a lateral border, a medial border, an apex, a base, a roof, and a floor. The lateral border is formed by the medial border of the brachioradialis, originating from the lateral supraepicondyle ridge of the humerus, while the medial border is formed by the lateral border of the pronator teres, originating from the medial supraepicondyle ridge of the humerus. The apex is formed by the inferior junction of the brachioradialis and the pronator teres, while the base is formed by an imaginary horizontal line drawn in between the epicondyles. The floor is formed by the brachialis muscle and the supinator teres. It's formed by the brachialis muscle proximally and the supinator teres distally, while the roof is formed by the bicipital aponeurosis, superficial fascia, and lastly the skin. What are the popliteal fossa? The borders of the popliteal fossa. Firstly, you have to note that the borders of the popliteal fossa are mainly formed by muscles of the posterior compartment of the thigh and the leg. The popliteal fossa has a superior medial border, a superior lateral border, an inferior medial border, and an inferior lateral border, a floor, and a roof. The superior medial border of the popliteal fossa is formed by the semimembranosus and the semitendinosus. Note that the membranosus is located medially while the tendinosus is on top, while the superior lateral border is formed by the bicep femoris. Coming down inferiorly, the inferior medial border is formed by the medial border or medial border of the gastrocnemius muscle, while the inferior lateral border of the popliteal fossa is formed by the proximal part of the plantaris and the lateral head of the gastrocnemius muscle. Now, what are the contents of the cubital and popliteal fossa? Starting with the cubital fossa. The cubital fossa, I'm going to be listing the contents from medial to lateral. Firstly, we have the medial nerve, then we have the brachial artery, then we have the bicep brachii tendon, and lastly we have the medial cubital nerve in the roof with other structures such as the medial and lateral cutaneous nerve of arm. Then in the popliteal fossa, we have four main components or four main structures contained in the popliteal fossa, which starting from the popliteal artery, which is the deepest structure in the popliteal fossa, and it also continues as the femoral artery. Then we have the popliteal vein, which accompanies the popliteal artery. So we have the tibial nerve and the common peroneal nerve, which are branches of the sciatic nerve. Now, there are other structures also in the popliteal fossa, such as the medial and lateral cutaneous nerve of thigh, the genicular branch of obturator nerve, the connective tissues, and other lymph nodes. Now, lastly, I'll be talking about the clinical correlates or implication or importance of the cubital and popliteal fossa. The cubital fossa serves as a site for intravenous injection, it serves as a site for collection of blood samples, serves as a site for nerve block for pain management. Generally, the cubital fossa is an important area for medical processes involving the arm. Now to the popliteal fossa. The popliteal fossa is an important area for examination and treating conditions related to the knee joint, such as swelling and administration of injections. The popliteal fossa is also important for checking lymph node enlargement. It's also important for nerve block, for pain management. It's also important for assessing deep vein thrombosis. Now, that will be all about the cubital and popliteal fossa. Thanks for watching.